For the diagnosis of IBS, it is something that physicians can do positively in the office. Research has shown that family physicians in general, and I think it's just human nature, to really want to eliminate organic disease, such as colitis, Crohn's, colon cancer, celiac. And research has shown that family physicians tend to hold back from making a positive diagnosis of IBS and are always trying to rule things out. Specialists of IBS, even gastroenterologists or digestive disease doctors that see patients, that are not IBS tend to do a lot of testing. But research has shown that if you fulfill the positive criteria of IBS, there's a very good chance that you do not have organic disease. IBS, by definition, is a pain disorder. It's associated with chronic abdominal pain of at least once per week. It's also seen in the previous 3 months with a duration of at least 6 months. So you need to have abdominal pain every week for the last 3 months, and this has been at least 6 months duration. So it's usually patients with IBS have had IBS for 5 to 10 years. So it's a chronic pain disorder. It's not something that happened after you came back from a trip. It's not something that you had pain over the weekend and you need an ultrasound. So it's something that's chronic and frequent. The abdominal pain is also associated with the change of 2 criteria out of 3. So the 3 criteria are: the pain is changed with defecation. So when you're passing stool, it either increases the pain or relieves the pain. It's also associated with a change in stool frequency in terms of diarrhea or constipation. So you're going 3 times a day, you're going once a week. It's also associated with a change in stool form, where the stool is now liquidy like mush or mustard, or you're passing little pellets that are hard to push, or a very hard, lumpy stool. So you want your stool to be a nice sausage or a nice banana, but if you've got a chronic abdominal pain and it's changed with defecation, it's changed with stool frequency, it's associated with the change in stool frequency, and it's associated with change in stool form, that's IBS. And we can be reassured that IBS can be done as a positive diagnosis because if studies have shown that when you take these positive diagnoses and you remove the red flags, then the chance of finding something serious that needs to be followed up is very, very low. There was a study in Denmark looking at 300 patients, and they divided the patients into using the criteria or doing a full-on investigation, and they demonstrated that missing something serious, such as Crohn's, colitis, or cancer, was extremely low. So IBS can be classified into 4 different subtypes, and the reason that we classify patients into different subtypes is 2 reasons. Number 1 is to do adequate research and make sure that we have a homogeneous population of patients that are suffering from the same illness and can be treated in the same way. And the second reason that we do the subtypes is to classify patients suffering from the same illness in order to target treatment towards these patients. We can classify IBS into irritable bowel or IBS-D, diarrhea, if you have abdominal pain associated with a lot of diarrhea. You can have IBS-C, so IBS associated with constipation, IBS mixed, if you have both alternating constipation and diarrhea, or you can have IBS-U, or unknown or unsubtype. The IBS diarrhea and IBS constipation is very important because remember that the number 1 definition for IBS is a chronic pain disorder. Therefore, patients that suffer from diarrhea and do not have pain do not have IBS. They are often classified as IBS, but they don't have IBS. They've got chronic idiopathic diarrhea. So the chronic diarrhea needs to be investigated, and the treatment is often different than IBS-D. Patients that are constipated and don't have abdominal pain have idiopathic constipation or chronic constipation. And these patients need to be investigated as well. So abdominal pain and constipation, abdominal pain and diarrhea are IBS, but no pain is chronic diarrhea and chronic constipation.